Hello everyone. Today's case is an old man presented to us with the symptoms of urinary tract obstruction. On ultrasound, the prostate was markedly enlarged. It was about 100 grams. Normal size is around 25 to 30 grams. In the video, you can also see there is a markedly enlarged prostate, and this is also projecting into the base of the bladder and leading to the narrowing of the prostatic urethra. In this diagram, you can see there is a normal prostate and the urethra is widely open. But if the prostate enlarges, this causes the obstruction of the urethra, especially if the median lobe enlarged. This will lead to the narrowing of the urethra, and it will cause urinary tract obstruction. In this diagram, you can also see the enlarged prostate, which is also leading to the thickening of the urinary bladder wall. So if the urinary bladder wall will thicken, this will lead to the chronic cystitis. Further, it will lead the multiple outpouching from the bladder wall, which are called the diverticulum. These are due to the straining of the patient due to urinary tract obstruction. The patient has to strain during the urination, and this will lead to the weakness of the urinary bladder wall and the outpouching of the urine. So this is another example of the multiple outpouches, which are called the multiple urinary bladder wall diverticula in this case. And further, if we go for the imaging, like on the cystogram, we can see there is a contrast filled outpouching from the urinary bladder wall. This is a single diverticulum from the bladder wall. In some cases, there are the multiple diverticulum which are due to the persistent obstruction and straining of the patient. Like in this patient, there are the multiple diverticula which are filled with the contrast, and these are the outpouching of the urinary bladder wall filled with the contrast. This is another example of the urinary bladder wall diverticula. These are called the Hutch diverticula. These appear as Mickey Mouse, and these are usually present at the VUJ junctions, and these are due to the weakness of the bladder wall. These are congenitally present. So now come to the treatment of the patient. We have multiple options. The first line treatment is through the medicine which are called the alpha blockers. If these will not cause significant benefit for the patient, the next line treatment is a surgical. The surgical option is called the transurethral resection of the prostate. The third option is an emerging technique, and this is newly introduced. This is called prostatic arterial embolization, and the side effect of this technique are minimal, and so this is very preferred technique for the treatment. Thanks for watching and your patience.